Largest hospital groups in Rhode Island are requiring masks to be worn once again. This as respiratory viruses are on the rise. 12 News reporter Kristen Burnell joins us now live in studio with the latest. Kristen?
Kim, the Department of Health says they are seeing a spike in COVID-19, flu, and RSV cases as 2023 comes to an end. Care New England and Lifespan hospitals have since updated their mask policies for both staff and patients. 'Tis the season for respiratory diseases, and some local hospitals are once again requiring masks. Care New England announced its hospitals are making masks mandatory for all patient units. A spokesperson says this was instituted last week as respiratory illness rates have been rising. Meanwhile, Lifespan is also requiring staff to wear a level 2 surgical mask. All visitors in hospitals and medical offices must mask up as well. This includes inside either a patient or exam room while the patient is receiving care or treatment. The Rhode Island Department of Health says they are seeing an uptick in COVID-19 and flu cases as the holidays and 2023 come to an end.
One of the things I think I would strongly encourage is having a discussion with whoever your primary care providers, their professional, who you can sit down and have a conversation about getting vaccines.
First detected in the U.S. back in September, the new COVID-19 variant JN1 is now accounting for half of U.S. COVID cases, and that is the case here in the Ocean State, too.
So far, what appears is that the JN1 variant, which is likely the predominant circulating variant here in Rhode Island, that our vaccines and our therapeutics appear to be still effective. And so now is a great time to be thinking about getting the updated COVID vaccine.
And she adds the number of COVID-19 cases are lower than this time last year. Reporting live in studio, Kristen Burnell, 12 News.
Other news tonight, there are changes in masking policies at some of our local hospitals. Some are now requiring patients and visitors to wear those masks again. 12 News reporter Kristen Burnell joins us now live in studio with details on why these changes are being made. Kristen?
Kim, following the holidays, all Lifespan and Care New England hospitals are reinstating mask policies as they say respiratory illness rates are on the rise.
Right around the holidays when we're visiting with others and we are seeing those metrics for COVID increase, whether they're wastewater or COVID-related hospitalizations and ED visits.
Almost 4 years since the COVID-19 pandemic began, some local hospitals are masking up once again. Care New England announced its hospitals are making masks mandatory for all patient units. A spokesperson says this was instituted last week as respiratory illness rates have been rising. Care New England operates Butler and Kent hospitals, the Providence Center, and Women and Infants. Meanwhile, Lifespan is also requiring staff to wear a level 2 surgical mask. All visitors in hospitals and medical offices must mask up as well. This includes inside either a patient or exam room while the patient is receiving care or treatment. Lifespan runs Rhode Island Hospital, Hasbro, Miriam, Newport, and Bradley hospitals. The Rhode Island Department of Health is urging people to stay vigilant of the flu, COVID-19, and RSV as the holidays come to an end.
We've seen definitely an increase in flu and in COVID over the past few weeks, and RSV is also high, but appears that it could be peaking.
Dr. Bornschein tells 12 News COVID-19 cases are lower than this time last year, but says at-home tests may have an impact on the numbers, as those results may not be reported to DOH.
So we don't have the line of sight on how many cases that we have, but we do have some really robust surveillance metrics.
Now, she is also encouraging people to speak with their primary care doctors about staying up to date on their COVID-19 and flu vaccinations for everyone 6 months of age or older. Reporting live in studio, Kristen Burnell, 12 News.